Oh, hi, this is the CAPSA team with information on Know Your Rights from a cultural perspective. These will be given online as a consultation framework for you to actually get more information if you're admitted to a mental health ward. More importantly, the basis from an Afrocentric perspective is challenged the whole definition of mental disorder and has it been applied in a culturally appropriate way to support you in the mental health system. We start off with Know Your Rights in relation to section 135, 136, particularly from black people using an Afrocentric guide. Both of these are places of safety, both of them lead to entries into inpatient, and both of them you can get advocate support from a CAPSA team. We also want to ensure that you have information and can consult with us on your rights under section 2, admission for assessment for 28 days, or a section 3, which is a care and treatment order for 6 months, for both of which you have a right under 132, and we will actually ensure that you are given your rights and your rights to appeal to a tribunal. We also want to ensure that you have your rights under section 117, which is discharging the community treatment order. And you actually know you have a right to a cultural care plan, and that should be culturally informed. In that, as mentioned before, we give you more specific details, which you can have be online, about your rights under section 3 and the community treatment order. Here we think it's really important that we give you a definition of what this actually means and why it's really important that we as black people challenge the definition and the application of this part of the legislation. We also crucially want to make sure that we consult with you and empower you to talk to your doctors about your medication and your treatment. And more specifically, is this the right diagnosis? And also, if you've got comorbidity issues, which be culturally relevant, that's also addressed as part of your care plan. While in hospital, it's really important that you understand there are inpatient models and inpatient responsibility for staff, and you should be given a welcome pack, and we will ensure in our work from an Afrocentric perspective that every black person has access to that information. That information will be broken down specifically about what will happen from your point of entry, your point of assessment, and your point of discharge. But more importantly, this will be informed by a culturally appropriate perspective. What we mean by a cultural perspective in terms of knowing your rights is that cultural needs is the center of your rights and your care plan, and you should ensure that when you're in a ward meeting or a review that the care plan reviews that. We also want to make sure that you have an understanding that there are other pieces of legislation that will give you powers, and these are the Mental Health Capacity Bill, the Human Rights legislation, the Equality Act, and the new recommendations under the Mental Health Reform Bill. CAPSA will actually make sure we actually address and support you in that process. Part of CAPSA's responsibility as an advocate and consultation is to make sure we represent you in every stage of your life cycle, from admission, section, tribunal or discharge. That also we will be working with the agencies involved in your care, which could be the community mental health team and also the wards teams, to make sure that we address the statutory responsibilities under the Mental Health Reform Bill, Advanced Choice Document, cultural care, and also issues around restraint. Part of our model of consultation is based upon what we call cultural competency. That also you have access to a right-based consultation model that ensures that practitioners are culturally capable, culturally competent, they are patient-centered and culturally aware. And that's something we will check in each stage of your journey, from your assessment, treatment under the ward, your care plan and your discharge. The model that we use is our operational consultation model, which is a model of challenging the culture of the mental health legislation, your mental disorder, which could be lead to misdiagnosis, and also looking at how we advocate for you through the mental health legislation and Sennis law. We also will be advocating and representing you in our work with primary care, approved mental health practitioners, community mental health teams and psychiatrists through to GPs, ensuring that we will be developing a culturally appropriate training which ensures that you have greater accountability and empowers you to challenge, unfortunately, racism that may be taking place in your practice and your experiences of the mental health system. We actually work very closely with the patient and carers race equality framework to ensure that we are addressing issues around information, around data, that we're also addressing staff awareness about how to work much more in a culturally informed perspective, and also that you as patients on the ward will be given different information about how you can make complaints, which should be registered and be used as part of our process of developing our advocacy program. Here we break it down in specific details about how we relate our advocacy and our rights-based approach to Section 1, Section 2, Section 3, 117, right through to your discharge planning. The thing that we ask you as we culturally and work with you towards this model is, do you feel culturally safe? Does your plan reflect your identity and belonging? How do we challenge senses of cultural trust? And also, how do we develop equal opportunities in your aspirations to move into education, employment, and better healthcare? One of the biggest responsibilities of our consultation with you and giving you advice is to operate the Mental Health Use of Forces Act, where we empower your carers and the community to make sure you are safe in the mental health systems. And this is really based on the revolutionary work carried out by Ajibola Lewis, who actually created, after the unfortunate death of her son, Sennis law training. Our responsibility is not just to consult with you about the mental health legislation, but also to ensure that the Mental Health Use of Forces Act is being introduced appropriately, particularly Section 5, which is ensuring that staff are trained to work in a culturally appropriate way, and also that your concerns, your frustrations are recorded in relation to Section 6 of the Mental Health Use of Forces Act. We also encourage you to begin to have a checklist of things that you should require and ask, is this culturally relevant? Is it part of my care plan? And that means your mental health assessment, your diagnosis and physical care, and also your needs around social, cultural, and spiritual. We also ask you to look at the impact on your experiences around the inpatient model, working with the community mental health teams, and also a cultural care plan that represents your cultural needs. But more importantly, we are working towards an integrated plan where cultural advocates will support you through this process. CAPSA and inpatient procedures will be provided online in the next coming months. From that, you'll get to see our operational plan, our staff themes about creating access to social care therapy. Also, our referral form will be online. We are now developing an integrated care plan, which is culturally informed between the wards, inpatient and community. We are then beginning to make sure that Mental Health Use of Forces Act is activated throughout all wards. But more importantly, we'll be developing with you a patient feedback form to ensure we actually use the information to address the changes that are required to make sure we are more culturally appropriate in our care planning. But more importantly, we want to make sure that you are safe and we have a clear reporting framework which links into something called the patient and carer race equality frameworks, which you will see an index in the index section. Lastly, for anybody who wants information, this is just a right-based consultation agencies, our empowerment framework for Sennis law, and also some information on medication. I thank you and I hope you found this useful.